the evidence that we have reviewed is actually telling us that periodontitis is really not only a localized disease, but that actually the body senses, and the body as a whole senses the presence of periodontitis.
Periodontal disease is an infectious disease, and we also know that if you have periodontal disease and you brush your teeth, you get a bacteremia, or you get bacteria in your bloodstream.
We have millions of bacteria in the mouth, and there is a clear possibility of inflammatory reactions derived from these bacteria. And there is clear evidence that there are people who are very susceptible to systemic inflammation. And this systemic inflammatory status can affect many different parts of the body.
The oral cavity is part of the body, and clearly not enough emphasis is placed on oral care as part of medical care.
Patients may realize that the mouth is an organ that cannot be neglected and that needs some priority, and with very simple methods, prevention can be pursued with a high degree of success. And by doing that, they also minimize or reduce the risk for systemic diseases such as myocardial infarction or stroke.
The impact of these kinds of findings on the profession are to change the role of the periodontist.
We need to provide clear recommendations to the medical profession that they should evaluate whether there is bleeding in the interface between the tooth and the gums, and whether there is gingival inflammation. And in these situations, they should recommend their patients for a dental checkup.